Self cycle and donor cycle. In self cycle, the injections are given to the wife for the follicles to grow, and once the follicles are ready, a small surgery is done to get the eggs out. These eggs are then injected with the husband's sperms. The embryos are then grown in the lab for up to 5 days, and these embryos are then transferred back into the wife's uterus. This is a self cycle. Now coming on to donor cycle. Donor cycles can be either a donor egg cycle or a donor sperm cycle. If for whatever reasons the wife's egg count is very low or the egg quality is not so good, then we would suggest they go in for a donor egg cycle. Here the injections for the follicles to grow are given to the donor. The donor undergoes the procedure and the eggs are removed. These eggs the donor's eggs are then injected with the husband's sperms. The embryos are again grown in the lab for up to 5 days, and these embryos are then transferred into the wife's uterus. This is a donor egg cycle. Donor sperm cycle. Here, if the husband's sperm count is very low or there are no sperms in the semen at all, then we would advise them to go ahead with the donor sperm cycle. Here, into the wife's eggs, donor sperm sample is injected, and the embryos that are formed after the 5th day are then transferred into the wife's uterus.